Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Pyridostigmine. Pyridostigmine is actually a long-acting drug and it is used as a drug of choice for myasthenia gravis. Tacrine. Tacrine is used in Alzheimer's disease but it is hepatotoxic, so it has been withdrawn. Then donepezil. Donepezil is the most selective agent and it is the longest acting agent. Then galantamine. Galantamine stimulates both nicotinic and muscarinic receptors. Then we have rivastigmine. Rivastigmine has both neuroprotective effect. It has neuroprotective effect and it is approved for the treatment of dementia in Parkinson's disease. Then memantine or memantine. Memantine is an NMDA blocker and it is an NMDA blocker used in advanced disease, and this memantine is useful for advanced Alzheimer's disease.
thank you and thank you for watching.